20 years ago, heart attacks were only a 60 plus problem. Nowadays, I have operated on patients in their 30s, sometimes 20s. Sadly, your heart, it doesn't check your Aadhaar card before getting blocked. Yes, in India, premature coronary artery disease is much more significant as compared to the Western population. I am Dr. Ashwin Venkatesh, a practicing cardiothoracic and vascular surgeon. And today, I'm here to talk about something uncomfortable but very important. Why are young people getting heart attacks? What can we do about it? The blood vessels in your heart, they are like fuel pipelines. Over a period of time, cholesterol gets accumulated and slowly starts blocking it. Earlier, this process used to take many, many years. But now, I see aggressive disease in very young people. It's not that the heart disease has changed, our lifestyle has. First, sedentary lifestyle. With the current office culture, I see many young people working for 10 to 12 hours a day in their desk. Long working hours, poor sleep, high stress, minimal physical activity. This is a lethal combination. It increases inflammation and risk. Our bodies are designed to move, not be a premium office furniture. Nowadays, we eat more refined carbs, sugar, and ultra high processed food than ever before. Your arteries treat this excess sugar like a long standing tenant. It just settles and refuses to vacate. Chronic stress increases cortisol levels and blood pressure. Sleep is when your heart recovers. If you're sleeping for 4 hours a day and calling it productivity, I'm sure your heart will disagree. Even occasional smoking causes the inner lining of your arteries to get damaged. Over a period of time, cholesterol easily builds up on them and causes blockage. There is no safe smoking. Your arteries, they don't say, oh, only weekend smoker? Fine then. No. India has one of the highest rates of young people having diabetes. Diabetes accelerates the disease process. Sometimes genetics loads the gun. Our lifestyle pulls the trigger. Sadly, South Asians, we have a very high tendency for early and much more aggressive coronary artery disease, even at lower cholesterol levels. Exercise itself is not dangerous. I'm not saying don't go to the gym. Please do. But problem arises when someone with undiagnosed blockages goes to the gym and exerts themselves too much. Always screen yourself in case of any doubt. I've seen young fathers being brought with heart disease. They are definitely too young to develop any heart problem. So if you have these following warning signs, please don't ignore it. Unusual fatigue, mild chest tightness, breathlessness or dyspnea, and family history of early heart disease. Young people often dismiss the symptoms saying tiredness. Your heart doesn't follow assumptions, it just follows biology. What can you do? If you're above 30, diabetic, or hypertensive, or have family of history of heart disease, please do the following. 30 to 45 minutes of exercise daily. No, walking inside the house may not be that effective. Please go outside, make sure you sweat it out. Eat healthy, balanced food. Avoid ultra processed junk food. All those home delivery apps, once a week is more than enough. Trust me, home cooked food is the best food. Annual health check after you're 30 years of age. Control your diabetes, BP, cholesterol if you have it. Stop smoking completely. Prioritize sleep. Please have that 7 hours of uninterrupted sleep a day. Your mobile is not the right partner you want to take to bed. Keep it away. Prevention is much better and much easier than bypass surgery. Trust me on this. If you're below 40, then this video is definitely for you. Share it with someone who thinks heart problems are only for old people, because prevention should start before your first symptom. If you found this video helpful, do share it with your near and dear and subscribe for honest heart related guidance. Thank you.